Hello friends, I am Dr Sadeep. In my channel, I will be doing videos concerning practical application of homeopathy and how to apply homeopathic principle in a classical way to be a successful homeopath. So I have already done many videos on this subject, friends. So if you are interested in these type of subjects, please like, share and subscribe our channel. So today's subject is, I have already done few videos on this miasm aspects. How to recognize the miasms on the facial features. What are the facial features which represent sora, which represent psychosis, which represent syphilis? So I have already done two videos on soric features, soric facial features and psychotic facial features. Dr. Grant Bentley, he's an Australian homeopath, Australian master homeopath who has spent his valuable 10 years in this research, and he has come up with a very good understanding of these miasms on the face. So these facial features represent the miasms, and you can also find the dominating miasm in each individual patient so that it will be helpful in treating the patient. So I already done two videos, that is soric facial features, psychotic facial features. Today I am talking about this syphilitic miasm facial features. So every miasm has its imprint on each individual patient. So how this sora look, how this psychosis look, how this syphilis look is one of the important feature for a homeopathic physician to come to a totalitarian remedy. So if you want to find a simillimum for your patient, you must have a key. You must have a key of miasm. Without having the key of miasm, it will be impossible or difficult to open the lock of the patient. So you have all the symptoms, you have come to a simillimum, you have come to a total required medicine for the patient. But until and unless you have a total knowledge of miasm, you will not be capable, you will not be in a position to open the door of cure. Simply because, as our Dr. Hahnemann, as our master Dr. Hahnemann has told, miasms are the root causes of all the ailments. Miasms are the root causes of the diseases. Miasms are the root causes of the changes in the healthy state to the diseased state. So if you not understand this miasmatic understanding, if you don't have the miasmatic understanding properly, and if you are not capable of finding the dominating miasm in each individual patient, it will be difficult or it will be impossible to find a exact matching simillimum for each individual patient, friends. So this knowledge of facial features, recognizing the facial features and understanding the totality of this dominating miasm is an art. So this has been researched for 10 long years by Dr. Grant Bentley, and he has come up with a book that is Facial Features and Homeopathy. This is one of a fantastic book. If you have time, please go through that book and understand it totally, friends. But I am today telling you what are the facial features of syphilitic miasm. So as you know, this syphilis is one of the deep disease or a deeper miasm which will destroy the organs. So syphilitic features on the face are seen very drastically. Syphilitic features are seen and you can recognize it by just first impression. So one by one I will be telling the features how the features look. What are the features you can find in the syphilitic patients? First, coming to hairlines. So in syphilitic miasm, these hairlines will be high hairlines will be there. There will be a baldness in the head. So these hairlines will be baldness. So there will be no hairs at all. So the baldness is much observed in this syphilitic miasm patients. So this baldness is one of the important feature in the hairline of syphilitic patient. Coming to forehead. Forehead will be curved. So this forehead will be curved. So forehead will be curved. Another feature in forehead is the forehead will be indented. So this indented feature, I will be putting some of the pictures. You can recognize and you can identify these features. So this indented nature means, so there will be a deep impression in between the forehead. So there will be a deep line, there will be a deep mark in between the forehead. It is called as indented. Indented forehead. If forehead is bulged, so forehead is bulged. Forehead has a indented mark. These are the two features on the forehead where the syphilitic miasm is presenting itself on the face of the syphilitic patient. So this is about the forehead features of syphilitic miasm. Coming to bridge. So if I tell bridge, this is a bridge between the forehead and the nose. So this is called as bridge. So this is called as bridge. So this bridge, this is called as bridge. So this bridge in the syphilitic patient will be absent. So as you can see in my face, there is a bridge, there is a gap between forehead, nose, and the bridge is there, a deep imprint is there here. This is called as bridge. This will be intended, it will be very deep sometimes, very deep in sometimes, or this bridge, very deep intended bridge will be there, very deep bridge will be there. That is a very presenting feature of this syphilitic miasm. So this will be not like this. This is a normal bridge, but the syphilitic bridge will be very intended. It will be deep, or there will be no bone at all. There will be no bone at all. So like that, if you find any patient, then it is the syphilitic miasm representing that feature in the patient. So then coming to eyes. So these eyes in syphilitic miasm are upturned. So as you see in sodic miasm, it is downturned. The eyes will be downturned. Here the eyes will be upturned. So eyes will be little upturned. So you must see the facial features carefully into the face of the patient. Or what Dr. Bentley recommends is, you must take the proper 5 pictures of each individual patient in a proper position, so that you can evaluate all the facial features of the patient to come to the dominating miasm. Dr. Bentley recommends like that. So in this eye features of syphilitic miasm is, first feature is upturned eyes, first feature. Second feature is far set eyes, that is eyes will be far set. So the eyes will be far set. Wide set eyes is a second feature in the syphilitic miasm. And another feature concerning eyes of the syphilitic miasm is deep set eyes. So eyes will be deep set. So you will be getting few pictures in between. You will see that and you can recognize that. So eyes will be upturned, eyes will be wide set, eyes will be deep set. These are the 3 important features of syphilitic miasms of the eyes. So another one features in the eyes is recessed lids. So lids will be lids will be falling like this. Lids will be falling like this. This is called as recessed lids. I will be putting few features. You can properly recognize and understand what I am telling. So these are the 4 features in eyes. One is upturned, second is wide set, and third is deep set, and fourth is recessed lids. So these are the 4 features in the eyes of the syphilitic miasm patient. Then coming to the next feature, that is cheeks. The cheeks bones are very prominent. So the cheekbones are very prominent. So you might have seen few people with a very prominent cheekbones. Cheekbones are very prominent. That represents that the patient is syphilitic in nature. Syphilitic tint has been affected in that patient or the person. So cheekbones are prominent, and below cheekbones there is a depression. There is a depression. It's shrunken under cheekbones. Shrunken under cheekbones. So under cheekbones there will be a shrink. There will be a shrink in the cheekbones. So if you find these 2 features, cheekbones will be prominent. This is about cheekbones in syphilitic patients. Then coming to lips. So lips, underlip will be little inside. So this is one of the syphilitic features. If you come to the mouth features of syphilis, the teeth are very, very important in syphilitic miasm. So this syphilitic miasm teeth will be cropped. They are overriding. The one teeth will be on another teeth will be on another. So this crockedness of teeth is one of the important features in syphilitic miasm. So this cropped teeth is one of the important feature. Crossover teeth. So teeth will be crossing over. Crossover teeth. So crossover teeth is one of the another feature of this syphilitic miasm. One is cropped teeth. So teeth will be here and there. That is like that crockedness of teeth will be there. And second is that feature of syphilitic miasm teeth is there will be sharp teeth, very sharp teeth. Teeth will be very sharp, pointed. So this is one of the another feature of teeth in syphilitic miasm. And the cupped teeth. So teeth will be cupped like. So like if you see the picture of crocodile, so this cupped teeth. So teeth will be cupped. Cupped teeth is one of the important feature of this syphilitic miasm. Overbite and underbite. Overbite means so this front mouth will be little backside and this will be little front. So that is called as overbite. So underbite like that. Overbite and underbite. So this is 2 features observed in the syphilitic miasm people. So this is about all features regarding teeth. Syphilitic features of chin. So chin develop, defined chin, very defined chin will be there. So you can see the chin very prominent, defined chin will be there. So this is one of the important feature of syphilitic miasm. And in syphilitic miasm, another one feature about chin is so chin will be pointed. So chin will be pointed. It will be very sharp and triangle shaped, pointed. So chin will be pointed. So this is called another feature of chin is pointed chin, and that chin will be well developed. So defined chin will be there in the syphilitic miasm patients. In syphilitic miasms, the ears will be very small compared to total face, and ears will be very large. So small ears and large ears are the 2 important features of syphilitic miasm. These facial lines of the syphilitic miasm is, one is dimple in the cheeks. So dimple in the cheeks tell you that dimple in the cheek tell you that it is a syphilitic miasm patient. So now it will be difficult to recognize this simply because so cosmetic surgery has come into play, and many a times for the cosmetic purpose girls and even boys make that dimple focused in their cheeks to the cosmetic purpose. So you must take note of this, and then you can take a note of this dimple in the cheek. Dimple in the cheek is a syphilitic miasm feature. It's down from the nose. So from the nose, down from the nose to mouth. So down from the nose to mouth, there will be lines. So if the patient sits before, you can see 2 lines here, like 2 lines. down from the nose, and here also 2 down from the nose. In psychosis, only around the mouth lines are psychosis. Syphilis is down from the mouth. So like this, these features are down from the nose, down from the mouth. So these are the 2 features of lines on the face of the syphilitic miasm patients. So important feature of syphilitic miasm is asymmetrical features. As you know, this syphilis is one of the very deep miasm, and it affects and destroys the body organs. So there will be a asymmetrical feature in the face of the syphilitic miasm people, syphilitic miasm patients. So sometimes nose will be very much tilted, eyes will be very much tilted, so mouth will be like tilted, so ears, forehead. So there are eyes, nose, mouth, chin. So eyes, nose, mouth, chin. These are the 4 usually will be turned, or usually will be deformed, like one eye will be like this, one eye will be like this. So eyes and nose will be tilted sometimes, nose will be crooked, and mouth will be having like this. So this all the features, that is asymmetrical feature on the face, represent the syphilitic miasm. So here the grading is also important. So what Dr. Bentley tell is, more than 2 to 3 features you must give only 1 point, that 1 point for that. If you observe more than 3 features, 4 features if you observe, that is asymmetrical in face, 4 features, that eyes also deformed, nose also deformed, mouth also, chin also, and the total deformity is observed in the face, more than 4 points if you can see, then you must give 2 points for that facial feature Dr. Grant Bentley tells. So this grading the features I will come with another video, but I'm just telling about these features of this syphilitic miasm, how the facial imprint of the syphilitic miasm occur, and how you can recognize those features on the face. So this is all today, friends. If you like this video, please like, share and subscribe our channel. In future I'll be doing a few more videos on these topics, friends. Thank you and take care.